Hello, Blazers. Welcome to episode 133 of UAB Green and Told, original release Monday, September 23rd, 2024. Through this podcast, we are able to share stories from members of the UAB community. Want to check out past episodes of UAB's most downloaded podcast? Visit alumni.uab.edu/greenandtold on Spotify or the Apple Podcast app. And while there, leave a written review so more alums can find us. I'm Greg Berry, a UAB alum and Director of Communications in the Office of Alumni Affairs. Affirmative, definitely, absolutely. All ways to say yes. Add to that list, okay. While it's not as glamorous of a synonym, okay can be just as powerful. For today's podcast guest, Dr. Sherry Colgin, that's been the case throughout her career.
It was one of those knee-jerk things that a friend of mine said, well, why don't you think about it? And I just went, well, okay, because my middle name is okay, I'll do that.
But that person would grow into a respected orthopedic surgeon, a career she embraced until health issues forced her to discover different passions. And that led her to, of all places, working with para-athletes. And as she'll share, the first time she walked into a pool with her team, she was blown away.
I had never in my life seen anything like it. People with no arms, no legs, with half their face missing from brain tumor.
And as we'll learn, walking into that pool had a lasting effect on her, all because of one thing.
It was that impactful on me to have started where I did in a little community in Alexandria, Alabama, and go all the way to the Paralympic Games just because I said okay. And that's the only reason I got to do it, is because I said okay.
Every 2 years, the world comes together. Exciting finishes, incredible performances, and heartwarming stories. Olympics? Yes, but also, and more amazing, are the Paralympians that showcase their skills shortly after the high-profile games. Dr. Sherry Colgin has a close tie to the Paralympic community. By trade, she's an orthopedic surgeon, but by saying okay, she's a para-athlete coach. And while she would wind up at UAB, completing her undergraduate degree closer to where she grew up in Fort McClellan, Alabama, was extremely important to her.
I felt very strongly about graduating from Jacksonville State because nobody had ever tried to get in medical school from Jacksonville State. They'd always transferred to either Alabama or Auburn or somewhere else, thinking that we just couldn't get in from Jacksonville. And I felt very strongly about that. Turns out that Wayne Finley, Dr. and Sarah and Wayne Finley, knew my father as a radiation safety officer. Dr. Wayne had been in the military, and my father had actually trained him in radiation safety. When I came through the interview process, Dr. Sarah knew the name.
What was it about medicine that drew you in? Did you know you wanted to be in that for a long time?
No. I had been accepted to the School of Marine and Ocean Sciences at Dauphin Island. A friend of mine had already matriculated down there after she graduated. She was a year ahead of me, and she was at Dauphin Island. She and I were very close. She called me. She said, Sherry, this is great, so much fun, but the problem is you're not going to be able to find a job when you get out of here. This was in 1974 and 5. And so I thought, God, what am I going to do? And I had stayed in the sciences. When I went to Jacksonville, I wanted to be a band director. And then I realized very quickly, music was a lot of courses that I just wanted to play. And I realized very soon, my freshman year, I said, all right, I'm going to stay in the sciences. And so when I found out that I couldn't get a job, I talked to another friend of mine who had actually transferred from Jacksonville to get into medical school. And she said, well, Sherry, why don't you think about going to medical school? And I thought, well, okay. I was a senior. And that's when I transferred down to Auburn because I was ready to graduate from Jacksonville. So I needed some courses that were highly recommended for medical school. So that's why I went down to Auburn for 2 quarters, transferred back to Jacksonville, and would eventually get into school. And that was in 1977. The only person in my family that I knew was a great-great-grandfather that had been in medicine, but nobody else in my family had ever been in medicine, and I'd never really been exposed to it. So it was one of those knee-jerk things that a friend of mine said, well, why don't you think about it? And I just went, well, okay, because my middle name is okay, I'll do that. And so I got in, and boy, was that an awakening.
Talk about the awakening, because it surely was a drastic difference from undergrad experience and all of a sudden going to a professional school.
Absolutely. And see, luckily I knew a few people from Auburn that had gotten into the class, but that was probably 5 or 6 people. So here I am, this little, redneck little girl from Alexandria, Alabama, and was in this class of 150. Luckily, it was a class that was full of women. I don't remember the exact percent, but it was close to 45 or 50%. It was pretty significant. And I was terrified. I had done well at Auburn, but I had no idea what to expect.
What was the goal once you were in medical school? A lot of people go different tracks. They want to become an OBGYN. They want to do orthopedics, different things like that. For you, what was that route?
I didn't really have any specialty in mind. I knew very quickly I didn't want to go into medicine because nobody got well. I knew I didn't like psychiatry because I was as crazy as they were. And it just, each time I got in pediatrics, I was sick the whole time. And then I got into my first surgery rotation and loved it. And my father, being a physics professor, was also a woodworker. And he would teach me how to do things with his woodworking tools. So I was fairly good with my hands. And so I took the last clinic rotation I did was in plastics with a guy who was just bread and butter plastics. He didn't do cosmetics. He just did all kinds of reconstruction. He was just a good old guy. He was in the Caraway area, and the guy had vintage cars. He had probably 14 vintage cars. He was a great guy, and I loved it. And so that's when I knew that's what I wanted to do.
Expand on plastics, because when you say plastics, as someone that's not familiar with medicine, I'm not even sure where to go. So delve into that and tell me a little bit more about that.
Plastics means to mold. And so a lot of the things he did was remove skin cancers from the face and then try to hide what was removed. A lot of people, when they hear the word plastic surgeon, they think cosmetic, facelifts, eye lifts, liposuction, that sort of thing. And that's an aesthetic part of plastic surgery. What I wanted to do was the reconstructive part of it, because I thought it was really fun, and I'd loved putting puzzles together as a child. And I think that's one of the reasons I was drawn to plastics, was because you would take from one area to move to another, borrowing from Peter to pay Paul, and not being noticed that Peter lost something. And so that's the real gist of plastic surgery.
You've been a practicing doctor for a minute. It's been a little bit. What was it like back when you were in medical school, and taking a look at how technology has changed things now?
Wow. Well, I've been retired since 2006, so I've been out quite a bit. What I see now is just phenomenal. Now, I eventually went from plastic surgery to hand surgery. I did my plastic surgery rotation in Memphis, Tennessee. The year between my general surgery, which I did 5 years here in Birmingham at the Montclair and Princeton hospitals, I was caught in between when they started the match for plastics. Plastics had always been just given away. It was sort of good old boys. You do well for me, I'll do something for you, and I'm going to give you my spot. And then the next year, they started the match, and I missed that year. So I did a year of burns, which was quite difficult. I did that in Memphis as well. And then I stayed in the program for 2 more and did plastics and reconstruction, and knew I wanted to do just reconstructions. I did not gravitate toward aesthetics at all. Knowing that I was coming back to Birmingham, classically, hand surgery had been done by plastic surgeons instead of orthopedists. Now, in Memphis, it was just the opposite. The hand surgery was done by the orthopedist because of the Campbell Clinic. That's where Campbell Clinic is located. And so I had not had much exposure to hand. So I came back to Birmingham at UAB and did a hand and micro fellowship that was orthopedic based. So for me, it was even broader than what some plastic surgeons would get because it was in an orthopedic based program. So when I got out, I did just about everything, because when you get out of your training, you have to you're an ER doc, basically. You're going from ER to ER to develop your practice and your patient load. And so I did a lot of hand, and eventually I gravitated toward that because it was incredibly challenging and a heck of a lot of fun.
As a woman, how did you gain the acceptance of the male peers? Because I know you had mentioned that the School of Medicine class was close to 50-50, 45-55, somewhere around there. But then you said that it's dominated by men and it's an old boys club. So how did you gain that acceptance?
Well, there had been two women in the program before me. One quit after 1 year and one quit after a year and a half. And these are community practicing surgeons who are willing to teach. And some of them had been trained at Barnes in St. Louis, at University of Pennsylvania. I mean, these were well-trained guys. And so they didn't want to spend a lot of time pandering to someone. And so it was quite difficult. And two of the guys who were hardest on me, and I used to put my hand in my pocket, in my pants, and pinch my groin, going, "You're not going to cry, you're not going to cry, you're not going to cry." And I kept saying, "They can't hit you. They can berate you, they can put you on the lowest totem pole, but they can't hit you." And even the guys were in my program that were below me or above me were terrified of some of these surgeons. But what they were trying to do was just to make you tough. And so they didn't want you to crack. When I finally was the chief resident, the two that had been the hardest on me were the best to me. They had seen me not crack.
At what point in your career did you start coaching and consulting athletes and Paralympians, para-athletes?
When I first started medical school, I didn't gain the freshman 15, I gained the freshman 40. And so I started running and I became addicted. So I ran every day. When I moved to Memphis in the burn unit, I met a woman whose mother was a triathlete. And Eva came to me and said, "Would you be interested?" Because she knew I was a swimmer. I had started swimming. And she said, "Would you consider doing a triathlon with me and my mom?" Mom? Yeah, okay. And I had just bought a bike and I was going to start biking. And so her mom had been a seasoned triathlete for years. I didn't know this. And so on our first bike ride, she dusted both Eva and me, and she was in her 50s. And so she trained us for her very first triathlon, and I was hooked. And so I did triathlon and even up to 2 years ago, I still can do it. And in 2002, I started coaching for the Leukemia Society. I had done their marathon program through them, and I thought it was a very good program. You raise money for someone, and I was hooked on it. When the Leukemia Society added triathlon to their program, I said, I want to coach it. So I started coaching in 2002. By this time, I was in an orthopedic group and said, I don't do plastics anymore, because in my career, I had become what everybody called me, the dead body part doctor. And meaning, yeah, that's pretty gross, but that's basically what I did. I did tremendous wound care. I did cases that somebody might have that just, it didn't work or fell apart. And those procedures were grueling. And so I gravitated toward hand, and then eventually joined an orthopedic group and only did hand. Starting in 2000 until I retired, I only did hand surgery. I was also trying to train for my own Ironman, and I was juggling being the first medical director for the Mercedes Marathon. So I was juggling a lot. And I had what's called the Widowmaker. I was in a spin class one afternoon, and I was in impeccable shape. I had an incredible trainer who had me just in tip-top shape. and it felt like a little bit of cricoid pressure. And I didn't pay much attention to it. I thought maybe something I ate. I started pedaling again, and it came back. So I left the class. And the next day, I just mentioned it to a friend of mine, and he said, Sherry, I think you need a stress test. I failed the stress test. And he said, you need an arteriogram today. And I argued. I said, I can't do it today. I've got too much to do today. And eventually he won, and I had a 99 plus blockage of my LA.
Wow. And
I think the only thing that saved me from dropping dead, which most people do, is because of my athleticism and my triathlon background. And so I had a stent put in, and over the next couple of years, I'd go back to work, and I wound up having to have my first bypass at age 49 and my second one at 51. What happened was my stent was still open, and hopefully to this day still is, but the stent caused a kink in the adjacent circumflex coronary, and it set up turbulent flow, which if you put rocks in a smooth stream, you get turbulent flow. And so I needed that bypass. So I had that bypassed, and I felt great. And I was training again. I was training for another Ironman, and I had epigastric pain. I thought, that's gallbladder pain. Well, it wasn't. I'd already had my gallbladder out. So it bought me another arteriogram, and the guy and my cardiologist said, Sherry, I've never seen this happen, but your vein graft clotted off. And my bypass, the vein clotted off. And so I had to have another bypass. So I had a redo, and I had a mediastinal MRSA wound infection afterward and got very sick. And they put me on an antibiotic, and I got a septic from the antibiotic on my PICC line and almost died. And that's when my cardiologist said, Sherry, you can't go back to work. I didn't know what to do. Here I am. I did 9 years of training. I was in the prime of my life. I was in incredible shape, and I was not going to be able to go back to my surgery. Here I am. I'm 51 years old. I'm retired. I feel fine, but I can't go back to medicine. And a friend of mine who worked at Lakeshore Foundation called me and said, Sherry, I need a swim coach. And I said, Jill, I'm not a swim coach. I can teach you how to swim across a lake, but I know nothing about competitive swimming. And she said, you know what? You don't have anything better to do, and you can learn. And I didn't have a comeback. I walked in the door and was greeted by a young man who is amputated at both elbows and above both knees. And you just go, okay, I can't. He got me out of my pity party really quickly. Yeah. There were 4 swimmers who had gone to Athens Paralympic Games in 2006 and had just come back and needed a swim coach, and they needed someone to take them to a swim meet. And that's what Jill needed. Their swim coach had quit, and she was in dire straits for someone to help them out. And I agreed to do it. Well, the thing was, it was a disability meet in December in Minneapolis, Minnesota. And I'm thinking, who in the hell has a disability meet in the middle of a snowstorm, which is basically what it was. I had one in a wheelchair, one almost legally blind. I had another who was a muscular dystrophy patient, and another with fairly significant cerebral palsy. And so, here I am. I didn't feel like I was babysitting, but I almost was. I walked into that swim meet, Greg, and I was blown away. I had never in my life seen anything like it. People with no arms, no legs, with half their face missing from brain tumor removal. I saw an incomplete quadriplegic, a 50-year-old man out of Atlanta, do all 4 strokes.
Wow.
And he couldn't get himself into the pool or out of the pool. But once you put him in the water, it was amazing. He could do a flip turn by bending his neck and pushing away with the little bit of function in his elbow. It was the most amazing thing I'd ever seen. And I knew then that I had found my calling. It dovetailed very beautifully into what I was called to do. And so I worked very hard on trying to learn how to coach competitive athletes. They have to deal with their disabilities every day of their lives. Getting themselves to and from somewhere without hands, or getting themselves in and out of a vehicle without legs. They have to do that every day. And then they train hard. I had one athlete, she was in a wheelchair. She had very dense cerebral palsy. I developed a woman here in town who had MS. Jennifer Schubel was one of my triathletes, and she came to me and wanted to do cycling. And they didn't have a cycling program. Well, I'd coach cycling because through my triathlon. So I helped her. She'd had a traumatic brain injury at West Point and was in a hand-to-hand combat drill and sustained a fairly significant traumatic brain injury and had to separate from the military. She went down to Alabama and walked on in soccer and then graduated. And at the time of her graduation, right afterward, she was diagnosed with MS. So she had a double whammy. And so we had to be very careful how we trained her. So we developed a program for her with a cooling jacket. And she and I went out to Colorado Springs and she blew the doors off. She would eventually become a multi-medal Paralympian. And so in 2008, I was fortunate enough to take Jennifer and Amy to Beijing. Amy won a bronze medal in one of her swimming events, and Jennifer won a gold, I think 2 silvers and a bronze. And it was the most amazing experience I've ever had.
That truly had to be a very humbling experience, especially the culmination of watching them perform on the grandest stage in the Beijing Paralympics. What was it like?
It was amazing. Because I was a home coach, I was not one of the team coaches. I had to pay my own way, and I did fundraisers because I was absolutely going to witness this. And I knew they were going to do well, but I had no idea how well they were going to do. And it was just, the personal pride I felt was like watching my child, do something miraculous. It's like watching your kid get married or have their first child. It was that impactful on me to have started where I did in a little community in Alexandria, Alabama, and go all the way to the Paralympic Games just because I said okay. And that's the only reason I got to do it, is because I said okay. A lot of people ask me, aren't you afraid of having a heart attack? Well, I was. That first year, I was terrified. But then when I got around these people with all these disabilities, I thought, God, Sherry, you're in your 50s. They're in their teens or 20s or 30s. They've got to deal with this, and you're worried about the possibility of another heart attack. Most of the people that die of heart attacks. Yes, I may drop dead tomorrow, but I saw what you can do if you don't worry about dropping dead. And so it was the exact right place for me to be at the exact right time. And so to this day, I still say okay.
That's Sherry Colgin. Dr. Colgin earned her Doctor of Medicine in 1981 and completed her fellowship in orthopedic surgery in 1991, both from the Heersink School of Medicine. As a 2-time UAB alumni, Sherry has a good understanding of what it means to be a Blazer.
I brag on UAB to everyone, because it gave me world-class knowledge. There's no question UAB has one of the top medical programs in the world in my heart.
Be sure to check out past episodes of the UAB Green and Told podcast. Listen in at alumni.uab.edu/greenandtold. Have a story to share or know someone who does? Email greenandtold@uab.edu. Finally, be sure to follow us on social media. Just search UAB Alumni on Facebook, Instagram, and Twitter. Thanks for listening, and until next time, go Blazers.